This is our VertebrEase TLSO. These are wonderful to correct posture, so your patient can be much healthier. If you think about the spinal nerves that come off the spinal column, off the spinal cord, those are vital, and they carry vital messages to and from, not just, we think about numbness in our fingers if we have pinched nerves, or sciatic nerve pain going down the back of our leg. But these nerves from here to here go to vital organs. So you may have very sick, very ill patients, and they may be taking a lot of pharmaceutical products to address the symptoms. But if we can straighten their posture and realign their spine back toward a normal alignment where it should be, and free up flow of nerve conduction to and from those organs like the heart, lungs, pancreas, gallbladder, spleen, our bowels, every part of your body, then it's vital to their health, and you may be able to get them off those drugs. We also prevent hospitalization and certainly rehospitalization with all our devices, but especially if you address the torso and the spine. We know with Pilates and other exercises to build the core, to strengthen the core, we may not be able to get our patients to do those type of exercises, but we can provide tension to them. We do these on infants, toddlers, all the way up to the largest, tallest adults. They also compress the spine. They make them very comfortable. That can actually make people with neurological problems concentrate better, maybe not act out. We see those type of compression garments with kids with autism help them to calm and to be able to think more clearly. So we find out more all the time about what compression does to enhance health and welfare on the spine. This is real easy to fit. It's going to come to you like this. Basically, it becomes part of putting the patient's clothing on. You would get them dressed. It doesn't matter how healthy they are. We're going to put it on them the same way. It doesn't matter if there's someone who can just sit in a chair or it's someone who walks around independently. We want to put it on them the same way. They're going to lie down on the back of this. You want at least a t-shirt on if they're not fully clothed. This is wonderful material. It's very, very patient friendly, and it's very padded. And there's airflow that goes through the foam under this fabric. But I just don't like anything next to the patient's skin. I want a cotton t-shirt or something on. But if you lie your patient on the back of this and start it down low, because it's just going to move up with gravity, you're going to start it below the tailbone. Their spine, with them lying down, and give them a second to relax, their spine should be in the best possible alignment because they're on their back. It's called supine. Also, if they understand you, try to give them a minute while they're laying down to stretch their spine to make them get just as tall as possible. What you want to create are spaces called interthecal spaces between the bones of the spine, and then we want to try to capture those. So for our restorative patients, for severe forward leaning and real fragile patients, this has a sewn-in plastic that when it's put on, it is very, very supportive. If you want even more, your physician wants even more, you add this, and you add it whenever it's appropriate. It might be for those orthopedic patients, you add it immediately. But we always want to be gradual with our fragile patients. You can tuck this down farther for your female patients. For male patients, we like to leave it as tall as possible. You just have to be careful of breast tissue. When you order these, you order a front measurement the height and back, the height you want it, and the circumference. Now you can take several circumference measurements on your patients and average them, or however you want to do it. The circumference is pretty forgiving. The only thing you need to be cognizant of in the front, and you don't have to worry about our infant, toddlers, and even young children, but with your adolescents, teenagers, on into adults, females, be cognizant of breast tissue, and you want to make sure you come under that. We're simply going to, you want to start this at the same level as the back. It's going to be a little below the pubic bone, and then it'll work up and it will end up right above the pubic bone. So we put this on. Another reason why we're putting this on the patient lying down is we want to capture their abdominal contents. It doesn't matter what age they are. They may not have good muscle tone, even these kids that have been sick very long. So we want to capture that. If you think about when you set up, immediately everything here goes down and forward, because once it passes the rib cage, there are no muscles to hold it in. So gravity is not our friend, and when that goes down and forward, all your abdominal contents, it pulls the spine offline. And if you try to fit someone standing or sitting, you have all that to contend with, and you're not going to do as effective a job of supporting their spine internally. So we're going to put it on like this. We're going to start, and these straps have elastic in them, and elastic will stretch about as far as it's going to go after about 2 months. So we want to pull those up, and you're going to simply slide them through the rings and back on themselves. You want them snug but not too tight. Then you're ready to sit your patient up. Now, if your patient requires a little more support already, then we'll add the side plastic. This comes with the device, so it's totally versatile for you. You simply open the side panel, and there's a little slot there where you simply slide this in, and that creates that overlapping of the plastic. You would just smooth that, and that closes it. Then when you bring it around, you have even more support. Now, before you would put these on like a post-operative patient, back surgery patient, or someone who's had some pretty severe trauma to their back, just show the orthopedic surgeon or the attending, whoever is responsible, for signing off on the product. Of course, all our products that are billed to insurance and Medicare Part B are by physician's signature, and you can order them, certainly, but if they're to be billed to insurance, then you would have a patient's signature. A doctor's signature, but show it to the orthopedic surgeon or the neurosurgeon and have him sign off on it that he feels like it's adequate support. We do, but we want to make sure that what happens to the patient is best for them, and we want to give them the support necessary. We replace a lot of rigid tortoiseshell type, totally surrounding plastic splints with these, with the TLSOs. Patients find those very, very hot. They can cut into them if they move at all. And we have had patients and caregivers that tell us that when they get their patient locked in that, almost immediately the torso starts to writhe, and they always use that term writhe, and a hip comes up. So there's always the fear that we might, with something rigid like that, we might be actually creating an episode of tone. We have kicked in that stretch reflex. We've gone past that. When the muscle says, I have to shorten, we have to let it shorten, but with tension to bring it back. And that's what this device does. Okay, once we'll put this side in. And if you have scoliosis, you may want to use it just this side, just on the side on which the apex of the curve is going. Okay, now again we put the belts on. Starting at the bottom, we always think about gravity. We're moving everything up. Then we'll help our patient to sit up. Whether they're a healthy patient or someone's been ill for a long time, no matter what age, we always want to assist them. We want to teach them good body mechanics. So any therapist will be teaching the patient how to get up and how to sit down. But let's make sure we assist them to a sitting position when we're fitting this. Now, the shoulder straps to me are a vital part of the success of this device. They're actually sewn to the back so they come under the arm. Your arm is going to be here. If you'll notice, they're very padded, so for those arms that are pretty tight, they start to loosen them up, and there's no pressure at all on any part of the body there. You're going to put them in the back, and everybody's shoulders are different. You have wide shoulders, you have narrow, you have round, you have square. So typically we're going to crisscross them. But there's plenty of the sewn-on loop material, there's plenty of hook that you can put them wherever they need to. Now, they're made like this with two pieces of hook, so if they're actually a little long for your patient, because everyone's body is different, you can trim off one of the sections of hook. Just be very careful and don't cut these threads that would unravel and not hold the hook securely on. But you see the belts have elastic. You want to just run your finger on them, under them, make sure they're not too tight. Make sure again that this hasn't come up high enough under breast tissue on women to put pressure. You want to make sure this is not putting pressure on their thighs so they can sit up comfortably and not have any problem there. The back is heat moldable. I think very seldom do people remold the back because it comes to you in a nice lumbar shape. You have plenty of open space here, so if you have bony prominences of the spine that are protruding. But if you did have, like we've had patients that had maybe a wound on one of those bony spines, we can do creative things like extra padding here to actually keep their body away from the plastic a little farther. Now they have all this padding inside that's between them and the plastic. But if you have wounds or special problems that you're kind of worried about, because we can't be too cautious with those people, then give us a call and we'll work through it. If we haven't dealt with it in the last 22 years of doing this, then we want to know what we would do in that situation. So we're always ready to learn new things and work with you to provide whatever you need for your patient. This device also comes, if you want a little more sporty, athletic look, in black. And this is a TLSO. Our LSOs also come in black and blue. They're basically the same style, only they're shorter. They're not as tall. And they're wonderful for that lower back pain. People in chronic pain have so much difficulty walking or doing anything. They can even have trouble concentrating. We see patients in so much pain. And if you put an LSO on them, TLSO or LSO, whatever is appropriate for their condition, and you can really cinch them in and you really support their torso and that posture and correct the spine, it's amazing how much they can improve just immediately. But again, with the LSO, you're going to lay them down on the back. You're going to have them stretch and try to make their spine and torso as tall as possible. Then you want to capture that and cinch those straps in to hold them snug, and you'll be amazed at the pain you'll relieve. There are people with back injuries and back pain, degenerative disc disease, bulging discs of all ages. And some people are not able to work any longer. They just can't handle the strain. They can't stand, they can't walk. So we want a healthier society, and we want to get people out of pain, get them off pharmaceutical products. And with these devices, we do a really good job of that. Again, these are our VertebrEase TLSOs, and which are thoracic lumbar sacral orthosis, and our LSOs, which are lumbar sacral orthoses.